Hard lump on the left middle finger. X-ray shows 2 cm well-defined round and densely chloric lesion attached to the cortex or proximal phalanx of the left middle finger. No trace uptake seen. Diagnosed osteoma. Simple lump on the index middle finger, and then on X-rays there is well-defined densely chloric lesion attached to the cortex of the proximal phalanx of the left middle finger. No trace uptake. Diagnosed osteoma. Simple. 36. Which structure is attached to the middle part of the anterior tibial spine? Anterior cochlear ligament. Anterior cochlear ligament. Which structure attached to the middle part of anterior tibial spine? Anterior cochlear ligament. Anterior cochlear ligament. Which is structure attached to the middle part of the anterior tibial spine? Anterior cochlear ligament. Question 37. Man has history of dislocated left hip, now with left hip pain. X-rays of flattening and sclerosis in the superior lateral part of human head, diagnosed avascular necrosis. The single joint involved, avascular necrosis, hip joint. Both hip joints involved, Porter's disease. The man has X-rays of flattening and sclerosis in the superior lateral part of human head, diagnosis avascular necrosis. Here all again avascular disease. Avascular necrosis of bilateral head, Porter's disease. Avian navicular bone, Steinbach disease. Avian second metatarsal head, Freiberg disease. Avian lunate. Okay, avian navicular bone, collar disease, avian lunate, Steinbach disease, and then avian tibial plateau, Osgood-Schlatter disease, and avian lower part of the tibia patella, Schindling-Larsen-Johnson syndrome. Question 38. Left groin pain. Ultrasound shows 2 cm hypoechoic lesion, bulging medial to the epigastric vessel on valsalva maneuver and absent on rest. Diagnosis right inguinal hernia. Now in this the mnemonic is MD don't lie, na? So medial is direct, and lateral is indirect. Hernia. So hypoechoic lesion bulging medial to the epigastric vessel, so direct inguinal hernia. Medial to the epigastric vessel, so direct inguinal hernia. Question number 40. 39. Question number 39. Avascular necrosis, navicular bone, collar disease. Okay, Steinbach disease, avascular necrosis, lunate. 40-year-old man presents with right groin pain, ultrasound shows 3 cm ecogenic soft remark staining the right inguinal canal on straining and which goes away on relaxation. What is likely diagnosis? The right inguinal and goes on relaxation diagnosis. Indirect inguinal hernia, because indirect hernia protrudes an inguinal ring and extends along the inguinal canal parallel to this axis. So again, 40-year-old man with right groin pain, ultrasound shows 3 cm ecogenic soft remark staining the right inguinal canal on straining and which goes away on relaxation. So it's distinct, so indirect inguinal hernia. It goes away on relaxation, so indirect inguinal hernia, and you can only see it on ultrasound. You can match distinct right inguinal hernia canal on straining and which goes away on relaxation. That knows indirect inguinal hernia. Next question number 40. Lump in the right groin after laparoscopic inguinal hernia repair. Ultrasound shows well-defined homogeneous hypoechoic avascular soft tissue mass lateral to inferior epigastric vessel in the right groin. No change on pressure or with valsalva minor. Diagnosed lipoma. Lump in the right groin after laparoscopic inguinal hernia repair and ultrasound shows well-defined homogeneous hypoechoic avascular soft tissue mass lateral to inferior vessel. No change on pressure or with valsalva minor. Diagnosis lipoma. No change on pressure or with valsalva minor. Diagnosis lipoma. Because you might think that lump in right groin is called hernia But when you see there is no change on pressure or balsamic manure and avascular soft tissue mass and homogeneous on ultrasound and diagnosed lipoma. 41. Run has right leg pain. Right leg shows a transverse cortical lucency and cortical thickening in the anterior cortex or mid-shaft of the tibia. Diagnosis: stress fracture. Now this is stress fracture. The right leg X-ray shows transverse cortical lucency, and cortical thickening in the anterior cortex or mid-shaft of the tibia. Diagnosis: stress fracture. X-ray shows uh, cortical lucency and cortical thickening on the anterior aspect of the mid-shaft of the tibia. Diagnosis: stress fracture. And he's a runner also. Question number 42. Which muscle is attached to the lesser trochanter? Ellipsoid. Which muscle is attached to the lesser trochanter? Ellipsoid. Question 43. Injury to the neck, open mouth view shows increased space between the dent and the medial border of the lateral masses of C1. CT shows fracture of the anterior and posterior arch of C1 vertebrae. Diagnosis: Jefferson fracture. Now, Jefferson fracture is extension subcutaneous C1 burst out fracture, stable because spinal cord intact. These both are Jefferson fracture. Now, on open mouth view, you will see anterior neck, open mouth view shows increased space between the dents and the medial border of the lateral masses of C1. GG shows fracture of the anterior and posterior arch of C1 vertebrae. Diagnosis: Jefferson fracture. Question number 44. 15-year-old boy with pain and swelling in his hands. X-rays periarticular osteopenia, loss of joint space at the metacarpal joint, and wide spaces in the proximal appendages. A parachute reaction seen in the metacarpal bones. Diagnosis: juvenile rheumatoid arthritis. Now, 15-year-old boy, he has pain swelling in the hands. X-ray shows periarticular osteopenia, loss of joint space in the metacarpal joints, and widening of the bases, widened bases in the proximal appendages, widened bases in the proximal appendages. Parachute reaction seen in the metacarpal bones. Diagnosis: juvenile rheumatoid arthritis. Question number 45. Man has a history of sexually transmitted diseases. Has one right knee. X-rays shows right knee. Shows collapse and fragmentation of the medial femoral condyle with subluxation of the tibiofemoral joint. There is calcified debris in the knee and a large joint appearance. Diagnosis: Charcot's joint. From Charcot name, remember chalk, like chalk. It breaks like chalk. So 5 D's of Charcot is destruction, debris, distension, disorganization, dislocation, density change. And causes are sugar, syphilis, steroid use, sphingomagalia, spinal cord injury, spinal bifida, scleroderma. So he has sexually transmitted disease, he has syphilis, and then there's managed sexually transmitted disease, but is knee joint. He is Charcot of the ankle joint. He has X-ray shows right knee is shows collapse and fragmentation of the medial femoral condyle with subluxation of the tibiofemoral joint. There is calcified debris in the knee and large joint appearance. Diagnosis: Charcot's joint. Question number 47. Woman has dysphagia, multiple swelling in the hand. X-ray shows hand shows widespread soft tissue calcification with terminal phalangeal resorption. Diagnosis: scleroderma. Now there is soft tissue calcification and acrosteolysis or terminal phalangeal reabsorption in keeping with scleroderma. Woman has dysphagia, multiple swelling in the hands. X-ray shows widespread soft tissue calcification, with terminal phalangeal reabsorption, diagnosed scleroderma. Question 48. 7-year-old compound fracture of the right tibia and fibula, has fever and septicemia. X-ray shows fracture of the tibia and fibula with extensive air and the soft tissue extending to the ankle and knee joint. Diagnosed: Clostridium infection. Okay. It's simple that when he has fracture of the right tibia and then has septicemia, on X-ray there will be fracture of tibia and fibula with air in the soft tissue extending to ankle. So air in the soft tissue is caused by anaerobic organism, which is Clostridium infection. Air in the soft tissue is caused by anaerobic organism, which is called Clostridium infection, usually after fracture, compound fractures. Then 49. Man has progressive pain and swelling of the left knee joint. MRI shows extensive low signal synovial masses on the right knee on T1, T2, and steer. Sequence marked degenerative joint disease. And there is pigmented sphenoidal synovitis. Now this is PVNS, pigmented sphenoidal synovitis. Now I do this. Man has pain and swelling of the knee joint. MRI shows extensive low signal on T1, T2, and steer. Look, it is a low signal on T1 and T2, extensive areas of low signal on T2, areas of low signal on T1, and steer also low signals. Correct? Low signal steer. And then marked degenerative joint disease. There will be also degenerative joint disease. Areas of degeneration in joint diagnosis, pigmented neural synovitis. Correct? Extensive areas of low signals in the knee joint with on T1, T2 and steer with pigmented with degenerative joint disease diagnosis, PVN, pigmented neural synovitis. This is similar. These are PVNS in ankle joint, pigmented neural synovitis. The knee joint, and I think this is ankle joint. Same mark areas of low signal on T1, T2 and steer, and which is degenerative joint disease. You can write osteopenia, etc. So diagnosis pigmented neural synovitis. Question 50 on slipped capillary femur epiphysis. What is the solid hydrous calcification? Type 1 solid hydrous calcification. Type 1 slipped. In slipped capillary femur epiphysis, what is the solid hydrous calcification? Type 1. Most common, I think, is type 2. Most common solid hydrous calcification. अच्छा